Welcome back, everyone. This is the second part to this new mini-series that we're starting here. Decayed teeth needing medical care. Can this patient be saved? Stay tuned, keep watching.
Sugar is so bad because the bacteria on your teeth love to eat it, and then the bacteria love to destroy your teeth. Sugar is really, really bad. Bad.
How do the bacteria destroy your teeth? You see these teeth? You eat sugar, you eat carbs, they stay on your teeth, they combine with saliva, become plaque, bacteria combines there too. The bacteria then eats the sugar, the pod creates acid, and that is what causes teeth decay. That's why it's so important to brush, and visit your dentist. It's recommended to brush your teeth, guys, twice a day. It's recommended to brush your teeth 30 minutes after you eat, because after you eat and you're waiting for that 30-minute period to go by, your teeth are more prone to, well, go away, erode, right? Go away while you're brushing, because they're weaker. Yes, they're acidic now. The pH in your mouth has dropped, and once your pH drops below 5.5, your enamel, the outer layer of your teeth, is way more prone to be brushed away, essentially. You see that white stuff in the teeth in the bottom there? That's plaque. That's the gunk that hardens, solidifies, and then it can turn into calculus. When it turns to calculus, you basically can't really get rid of it with floss, maybe a little chunk here and there, of course, but you're never going to truly get rid of it, all of it, unless you have like an actual professional hygienist, dentist who's doing the work.
Bad.
She has agreed to see Sarah, but is she prepared for the challenge ahead?
I don't know what Sarah's teeth are going to be like. It'll be interesting to see what we can save. Maybe there's things that we can't save, teeth that can't be saved, and then we're going to have to work out what we're going to do from there. But should be exciting.
This actually just gave me more confidence, because I also was in the fence. Like, I was like, I have an idea of what I can do. I don't truly know what to do yet. It's like, that's how this dentist is feeling. So it makes you have a little confidence. Because I was over here like, shouldn't I know what to do? Yeah, but you also just kind of have to go with the flow sometimes.
Gemma lives in Weston-super-Mare. She began to lose her teeth when she was 16.
So we got a new contestant.
But her problem is not decay.
If I hadn't had the eating disorder, where would I be now?
This is the new person, Gemma, on the table, and this is her teeth. So she said she had an eating disorder, just heard that. Her teeth look flat. Okay, there's a few things that are kind of like buzzing in my head. One, is she throwing up after she's eating? Because it kind of looks like it. Looks like there's a lot of erosion here. Also, it looks like she might even be a bruxer or something. Because like tooth wear, like she's like grinding on her own teeth.
Constant vomiting has cost Gemma 80% of her teeth.
Oh, yep, he just said it. Vomiting. 80%.
The acid levels in your mouth basically wear the enamel away on your teeth, and I guess once the enamel's gone off your teeth, there's nothing protecting them at all, and it does suddenly go from being a gradual process to suddenly they're gone. You know, hardly any teeth left at all.
People don't understand how aggressive caries can be. Yeah, that outer layer that we have is enamel, as I mentioned earlier in series 1, I believe, or episode 1. But once that layer is gone, your teeth can get destroyed very rapidly from there. Because that enamel is the hardest part. It's the hardest tissue in the human body, not bone. Teeth is not bone, if you're wondering. It's actually a tissue. And once that first layer of tissue is gone, the hardest tissue, that dentin layer is not as hard as that enamel. It will go away fast like this. And then when it reaches the pulp, it's done. No, teeth is done. That's where it's hit it with a lasso and extract that baby. Maybe you can save it with a root canal, but the odds are not in your favor once it reaches the pulp.
As her teeth eroded, her fillings were left high and dry. Even her diction has suffered.
I do talk very tonguey. I am aware of that. I have to try quite hard to speak.
One day I looked at her teeth and I went, oh my God, Gemma, they've gone. And she goes, no, but because she wasn't smiling anymore, she had nothing to smile about. She was so ill.
Gemma finally conquered her bulimia when she and her boyfriend Dan had Oscar, now 6 months old.
I only stopped when I got pregnant because it wasn't about me anymore, which is ridiculous, you know, that something like that, and you can just stop like that. It's like, why couldn't I do that before? But, you know, when I got pregnant, that was it, you know.
So I guess she had that moment in life where you really want to change, not just for you anymore, but for the people around you. It's like you want to improve now, live long, live a happy life for those around you, because now you have a purpose, right? And for her, after the baby, it just became her real, or at least one of her purposes. Maybe she has other ambitions, other purposes in life. I don't know her, which is awesome. This is what we need. We need a high motivation to help change a person's lifestyle. Because when a patient fixes their teeth, they're not just fixing their teeth, all right? Everything changes for that person. Once they have teeth, they look in the mirror, they're happy, they're like, wow, I actually look nice. And then they want to start taking care of their skin, get a nice haircut, maybe change the color of their hair a little bit. So like their aesthetic starts to really change everywhere. And when it starts to change everywhere, the person gets happy. Or we dentists, or soon to be dentists, are not fixing just teeth. We're fixing the teeth that impacts the overall of the human body.
Healthy for the last 2 years, but her teeth mean her confidence is still low.
I'm proud of her though.
Looking back at it, I regret so much.
She changed her diet.
Fixed everything now, but my teeth are still obviously there.
She actually looks
Gemma would give anything
really
to get
good,
her smile
happy
back.
and stuff.
People have this misconception that their own teeth are really bad. And sometimes that does lead to people not going to the dentist and feeling, oh, I think, what will my dentist say? I can't show anybody my teeth. Well, if you don't do anything about it, then maybe it may become bad.
In Bridgend, South Wales, one brother and sister have avoided visiting the dentist for over 10 years. Paul and Jenna Leach are terrified of the idea of treatment. Their early memories of the dentist have left them scarred.
Paul and Jenna.
When I was about 16, I went to the dentist and I had to have a load of teeth out. And then my mate had to carry me home because it was all painful, there was all blood coming out my mouth and all that. I was just scared then.
Dang, what's detrimental about this is that it's a couple, man. And they're both really negative towards, or think negative towards going to the dentist. So like, the impact, I feel like is even harder here. The motivation is just super lacking. Dang, and it feels like that guy experienced some kind of trauma or something.
You won't get near me. I'll do anything I can to get out of it.
Jenna's teeth are a constant source of pain and anxiety.
Good old sugar.
Punch it all up. I've got to make sure they're all soggy. Because a few times I've done it and then I've crunched on it. I thought, oh no. You have a drink and it's a sharp pain in your mouth. You have something to eat and you can't. I carry a mirror on me all the time so I can check my mouth while I'm eating, after I'm eating, before I'm eating, to see just in case if anything's changed in my mouth.
Not fixing your teeth, avoiding the dentist causes this teeth sensitivity, not being able to eat, and not being able to drink properly, because everything hurts. Everything is sensitive, painful. So if you're afraid of the dentist, I guess just go to the dentist, man. Just go to the dentist. Tell your dentist you're afraid, you know, don't be afraid to share that information. That's going to help the dentist a lot, actually, and allow them to do better and treat you better.
Jenna does brush her teeth. Well, some of them. She avoids the right-hand side of her mouth because it's simply too painful. Both Jenna and Paul rely on painkillers, sedatives, and antibiotics.
They're just avoiding the cause or delaying. I don't even know what the right words I'm looking for. I have no words. No words. Just go to the dentist. I know it's frightening. I know it's scary.
Paul's mouth is in such a state, even speaking is difficult.
So that's Jenna's teeth. I was expecting it to be a lot worse, to be honest. It just didn't shock me that much. Her front teeth actually look pretty good. You can actually save them, in my opinion. Don't think it needs a crown on those two front teeth. But like I said, I'm lacking information. I don't have x-ray. I'm not actually there seeing the actual teeth. But those front teeth, the two front right here, seems like it's just a simple class 4 probably. Yeah, those bottom teeth though. Those bottom teeth are destroyed so much. Maybe can save it with the crown. I don't know how deep or how bad the caries are. Because when your teeth are just dentin and not enamel, it gets harder to treat. Because composite ain't gonna really stick that well with dentin. It needs to be stuck to enamel really. But yeah, possible dentures, possible crowns here for sure. That tooth is probably gonna be extracted. And that one doesn't look too happy at all.
Jenna's teeth may be bad, but her brother Paul's
Or
look even
should I
worse.
say lingual? So that's his teeth. His look, in my opinion, I feel like they're worse.
Still only in their 20s, Paul and Jenna have no idea if their teeth can be saved.
But yeah, guys, we're going to call it there. That's part 2 of the video here. If you guys enjoy, subscribe, turn on the bell notification. Don't miss out on the other videos. If you guys are enjoying the series, let me know down in the comments, bro. Write something, you know? All right, guys, see you guys in the 3rd. Stay smiling.